I started using smokeless tobacco in about 10th grade, so that was 18 years ago, and it was more of just more of experimentation than more of my peers in high school were doing it.
I started using smokeless tobacco about, I guess, when I was senior in college. It seemed like it was, I knew some guys that I admired. I used to play racquetball, basketball with. They used to dip, and I remember taking my first dip. It was at the gym after we finished playing, and that was the beginning.
When you look at smokeless tobacco, it has high levels of nicotine in it, which is one of the most addictive substances on the earth. It's more addictive than cocaine and heroin. So nicotine, by itself does not cause cancer. And that's a misconception among a lot of patients and among a lot of tobacco users. Nicotine does not cause cancer. It is the addictive substance in tobacco. It's the other 3,999 other chemicals in tobacco that can lead to cancer, lead to disease.
Regardless how young you are, you're going to have problems sooner or later with tobacco use and smokeless tobacco products.
I'm in the Marine Corps. I just got back from a term in Iraq. Was there for a year. When I first went over there, I started dipping. Started to chew. It was real easy to do. A lot of my buddies did it. A lot of them did it before they went over there, but it kept me awake. That was the biggest thing. The first time I did it, it kept me awake on those long hours when I had guard duty. So that's what got me hooked.
As I got into the military, into OCS and follow-on assignments, it seemed like it was the thing to do. I mean, everybody who was somebody did it, to include some senior officers whom at the time we admired a great deal. And I think all of that together created an environment of acceptable use of smokeless tobacco. Even though deep inside I knew it was bad. I used to call it the slow poison. I was poisoning myself very slowly. I knew that, but yet, because of the environment I was in, I just couldn't quit.
Tobacco used in the field environment is more of, again, a comfort, and also it does help keep you awake, at least for me it did, and some other Marines have commented on that. In my experiences, I basically, if I was not eating, I had a dip in.
During our first meeting with TI in basic training, he offered the flight, which was about 50 of us. He offered us the opportunity to smoke or to chew his smokeless tobacco. So I think a lot of people did it because it was in front of them. I certainly tried it.
Tobacco harms the mission of the military, because not only you have to worry about supply, you have to supply the military member with their tobacco when they're out in the field in an operational setting. They have to do something with the waste in order not to be tracked out in the field. A lit cigarette in the field is a target. Somebody that's dipping, that spits on the ground, that can be tracked. There's a lot of issues with tobacco that people don't realize. And if somebody has to go into nicotine withdrawal while they're in an operational setting because they can't get their tobacco products, you're looking at somebody that may have a problem with their judgment, that may not be able to handle stress properly without the nicotine, and it could severely impact the mission.
The whole family gains when you stop using smokeless tobacco products. One of them is the financial incentive. You spend a lot of money on tobacco products, including smokeless tobacco, and that money can be used for other things in your house. So financially, it is a great incentive. The big incentive, I think, is the fact that they will have their dad or mom available for many years. If you use smokeless tobacco products, you cannot guarantee that you'll be there forever for them.
When people use tobacco, they use the argument that it's their own body and that their choice to do this to their own body. What they don't realize is that their family members and friends that care about them are affected as well. There's a lot of stress and about their health that their loved ones care about. So when you stop using tobacco, it's a victory for everybody.
When you look at family members, you look at the children of dippers, you look at them practicing spitting. They see their dad spitting, and they'll sit there and spit, and mimic the father. And that's not good, because they see it. People learn by, and the old thing of do as I say, not as I do, it does not work. It will not work. People have to see leadership by example. And if you want your child to be tobacco-free, you need to be tobacco-free. You need to set the example. And if you're trying to quit your smokeless tobacco habit or quit smoking, make sure your child knows how difficult it is to quit. Make sure your child knows that, because if they're ever fooled to start using tobacco, if they ever make the mistake and start using tobacco, they're going to know that it's hard to quit. It's not just, you just don't walk away from it. So if you take up the habit, if you've got the habit of tobacco use and you're trying to quit for your child's sake, make sure your child knows that you're quitting, how difficult it is, and that you need their support while you're trying to quit, whether it's your child or your spouse. It does help to have that support.
Those young people who like smokeless tobacco, who only like that little pinch between the gum and the lip, that pinch between the gum and the lip is where the cancer starts. It starts out as a little white patch. It starts out as a little roughness. It starts out as a little bitty area in your mouth, and over time it gets larger and it begins to ulcerate and it becomes sore. And by the time that 25 or 28 or 30-year-old young man, usually a young man, is coming in to see his doctor, he has a cancer. And then the treatment for that is really a radical surgical procedure, and that's used in order to save that individual's life.
Smokeless tobacco users will see an increase in recession, approximately about 5 more times the amount of recession is seen in smokeless tobacco users than non-tobacco smokeless tobacco users. And that affects their smile. It really literally pulls the gums away from their teeth. And as a result of that, their appearance will be affected.
There's other forms of damage from smokeless tobacco in the oral cavity, and one of the things you can see is bone loss around teeth. And given the fact that the bone is gone from around the tooth becomes weakened. If you can imagine a pole in the ground with the dirt being moved from around it, and it begins to wobble. So the tooth would end up moving while the patient was trying to chew, the bone loss would continue and progress, and the patient could end up losing the tooth. If you catch it early enough, you can go in there, take the gum out of the way, pack bone in there, and stabilize the tooth again. Again, it has to be done with the patient being off of tobacco, because if they use smokeless tobacco after that graft is placed, the graft will not work.
During the surgical interventions related to smokeless tobacco use, the self-grafting procedures, we obtain a small piece from the roof of the mouth and transplant it to the areas where we have the recession of the gums. The procedure takes approximately about 2 hours, and recovery time may be about a day or so. But these procedures can be tender, can be a little bit painful for patients. You have 2 sites, the roof of the mouth as a donor site, and the recipient site where you place the actual graft in place. And the graft is sutured in place, In about 6 to 8 weeks, we'll see usually total recovery of the area.
Initially, it's a little uncomfortable. The patient has to accommodate the way they chew. They can't eat the way they were. They'll have a dressing on there. It looks like a Band-Aid placed on the gum. It looks like a silly putty type material, Play-Doh, but it does protect the gum. And then there's some, some long healing that they have to protect the area.
Patients that undergo these procedures will be in a very, very soft diet, and that's a challenge for some people, and they can't eat anything hard for several weeks. The other thing is that they have stitches in the mouth, and for some people, having stitches in the mouth is another challenge. The roof of the mouth will feel like a bad pizza burn, and that could be there for a couple of weeks at least, and that will be very, very painful.
The procedure, somebody asked me, how was the procedure 2 days after I had it? I told him the effects were about the same as having 10 root canals done at the same time.
The recovery period after a gum graft it can be pretty painful, but it all depends on the patient, and it can stop whatever type of job you have. It puts it on hold, whatever type of training you're going through, because you can't do any physical activity, and if you talk too much, it actually it hurts after a while just by talking, because the movement of your tongue against the tissue in the area that was grafted. It also changes your diet. You have to go strictly liquid, and so the only thing you can get at chow hall is a soup. The reason I decided to quit is I received some injuries to my mouth in Iraq, and so I had several surgeries on my upper jaw, including gum grafts, and they also, when they were performing those procedures on my upper jaw, they noticed my lower jaw, where I had dipped for the majority of those 18 years, said that the recession was basically exposing the whole teeth all the way down to the roots, and it was threatening. I was about to lose those teeth, basically. They would fall out, and so it was a pretty big wake-up call that I was going to be losing my teeth.
The reason I wanted to quit was, 1, my teeth were getting stained. 2, my breath in the morning with a smell. I mean, that leaves a certain, distinct odor or a smell in your throat. You had to deal with that. The thought behind that, I really needed to quit, because, in the future years, I wanted to keep my teeth. I did not want my teeth falling out when I was 50. The command environment is more important than just putting pictures on the walls. I think the command environment, the commands and the commanders and the people in charge should, 1, set the right example, because you can see a lot of senior staff and some junior officers that are out there using tobacco.
Strong messages from our leaders really will make a difference, and it makes it it brings it home to the sailors, soldiers, airmen, Marines, that they don't need to be using tobacco to be a member of the U.S. military service.
One of the biggest responsibilities as leaders, I think, is to make sure that we promote good, healthy habits, and Smokeless has no play in that. So our leadership has to be there, supporting our young sailors, Marines, airmen, Coast Guards that are trying to quit, because it's important for them to do that.
And also just having the higher ranking enlisted and officers, just seeing them not using tobacco, period, is definitely a good, it's very influential on the younger Marines.
One of the things I'd really like to see happen in the military is that a strong leadership message come out to all military members, especially from the senior enlisted leadership, that says that tobacco is bad. You need to quit. You need to quit for your own sake. You need to quit for the military. You need to quit for your loved ones. You need to quit for your wallet. You know, those kind of things need to be stated.
For anyone to think that smokeless tobacco is somehow healthier than smoking tobacco, I think they're very much underestimating the addictive powers of smokeless tobacco, as well as the terrible health effects that could follow.
They don't really understand, I think, really the harm that smokeless tobacco also gives you. I've seen the photos where they've just had cancer rotting out the lower portion of their mouth, and they've had to have it removed or their tongue removed, and it is very harmful. And I don't think very many women want to go up and kiss the young guys or older guys if they've got this smokeless tobacco in their bottom lip. It's just not very pleasant.
Some of the programs available for people that are interested in quitting using smokeless tobacco products are the tobacco cessation programs available in each of the bases, not only for Army, Air Force, but also for the Marine Corps. And we have them available throughout the world, and they provide free of charge motivation, not only through one-on-one counseling also, but to medications that can be used to help you quit.
Every patient that I treat, that I do a periodontal surgery for, they are either tobacco-free or I support them with tobacco cessation, patch, gum, medications as necessary, and in order to help them stay tobacco-free, because the patient wants to have it succeed, and as a clinician, I want to see them have the best outcome possible.
I believe that I am one of the fortunate people that was able to get away with having a surgery and be okay again. I think there's a lot of other people out there that get a lot more serious effects than I did. And these effects are related to diseases as serious as cancer. And that is not uncommon for people who use smokeless tobacco.
That are out there that do relapse don't get down on themselves, beat themselves up as far as, well, I'm not strong enough to quit this, because it has such a tight hold on you. But it's able to be done.
Stopping when I did, I think, may have helped in me not getting a more serious disease, which could potentially have been cancer.
I can't imagine kissing somebody who, uses smokeless tobacco.